You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible.
Let's now talk about coronavirus's impact on the country. We are seeing it come back with a vengeance. We're seeing California, Texas, significant numbers there. The governor of Texas, Greg Abbott, this idiot, okay, who was so gung-ho, Greg, your mother's living there, all my family's there. He was so gung-ho about reopening the state. Now, all of a sudden, guess what? He's saying, hey, can y'all stay home? Well, you didn't listen to the mayors of the cities and the county judges who were telling you don't reopen the state so fast. Folks, we have 2,336,615 cases of coronavirus. 121,000 people have died. 784 of those deaths are new. Now you have the federal government, Erica, pulling the federal testing sites out of places like Texas and Arizona where the numbers are going up. Why would you pull testing out when the numbers are increasing?
Yeah, we actually saw reporting on this, Roland, like back in April or early May. When we're looking at, and it's really interesting that this is happening, right? But we knew that this was going to happen because the coronavirus is a novel, meaning it is a new virus. So when those folks who were out front saying, well, it's only impacting this demographic, so those demographics need to make sure that they stay at home. Everyone else can kind of, play it by ear, so to speak. And now we're seeing that the numbers are up amongst the 18 to 29 group because this is a new and novel virus. Again, I think that it's really important to reinforce that a lot of the decisions that were made around the state executive governors to reopen as early as they did, to allow those stay-at-home orders to expire as early as April and May, were made because of economic reasons, specifically when the data began to creep out to show that this virus was impacting Black and brown people, meaning the folks that engine the economy. Also, is disproportionately impacting them. We can continue to sacrifice them in the name of business. So now what we're seeing happening in your home state of Texas is that the Texas Children's Hospital has had to start making their facility available for grown people because the numbers are just that staggering. And I was watching Business News today. I'm watching different doctors who are painted with fear because they're really scared that there's going to be an explosion that cannot be contained, bearing in mind that the CDC director has told us today that the numbers may be 10 times higher than what we're seeing, the 2 million that are being reported. So our nation is really in a critical place. And if folks do not wear masks, if people do not social distance, what they're seeing happening in Texas will be happening in their state very soon.
Greg, real simple. I mean, bottom line is these governors, these Republican governors, were trying to follow Trump's lead. And people like Dr. Ebony Hilton, I got a doctor coming up next, kept trying to say, y'all, take this thing slow, stop trying to ramp up. Now they're seeing what happens when you don't listen to the health professionals.
That's right, brother. And as we just heard, brilliantly put, Erica laid us down through it. We are the ones who are going to suffer disproportionately. This idiot, as you say, Abbott, your family, my family, and not just our two families, but millions of people in the state of Texas now subject to this clown. Sylvester Turner in Houston, one of the counties that has been, they're saying they're going to suspend elective surgery. Mayor Turner comes out and says, hey, man, my intensive care wards are already at 97% capacity. My sister and brother-in-law are in healthcare. And they'll tell you just as fast as, anybody else will tell you, look, when this thing gets overwhelmed, it's going to be in those major cities where our people are. Chokwe Antar was on television earlier today. Chokwe Antar Lumumba, the mayor of Jackson, Mississippi. Those idiots in Mississippi, the attorney general there still hasn't reached an agreement to share reporting data with the biggest city by a factor of 3 in the state of Mississippi and the place where the hospitals are. So who is going to be overwhelmed? Our Black and brown women, and men who are first responders working in those hospitals. Those people are going to come in. They will be overwhelmed. Finally, idiots like Brian Kemp in Georgia, idiots like that fool in Florida are pressing this thing to the point, when you look at the map, the red states where there's up, there are 29 states where this thing is going up. You see most of them, the old Confederacy and those Republican governor states. You're seeing the continuing fraction of the country as Cuomo and Phil Murphy in Jersey and the guy in Connecticut are like, y'all can't come here from these states. And if you come here, you got to sequester for 2 weeks. This is not only testing the United States as a concept, it is going to lead to the fracture of the United States as a concept. Mark my words on that.
All right, joining us right now, Dr. Karissa Culbreath, Chief Medical Director of Infectious Disease Diagnostics at Tricore Reference Laboratories. Doc, glad to have you here. This is what I find to be just unbelievable. I'm watching this whole deal right now, and it's amazing. It's amazing. Are they not listening to people who are putting their lives on the front line? I'm sitting here and I'm going, what are you doing? Doctors and ER folks, they're screaming in Texas and Arizona. They're fighting these nuts walking around with their guns. Oh, no, I don't want to put a mask on. As if 121,000 dead just didn't happen.
Right. No, I can't understand. I think at this point, everybody knows somebody. I think early on, people had a lot of questions. Is this real? Is this a hoax? But everybody knows somebody, or people themselves have experienced the virus. This is not a hoax. This is absolutely real. And so the way that we deal with viruses like this in hospitals that can be transmitted from person to person is by wearing masks. And I can point you to the data that shows that this works. It's not just with this virus. I think everybody, whether or not you think coronavirus is a fluke or not, everybody knows that the flu is real. And if you look at the numbers of flu cases, they all fell dramatically once we started social distancing. So we know now coronavirus is real. We know social distancing stops viruses. Coronavirus, flu, other colds. We've seen cases of influenza-like illness, so common colds and other respiratory illnesses. They just fell immediately once we started social distancing. And now that we're wearing masks, people have to see that this is really real. And there's a way that we can protect ourselves and we can protect others.
So the spike is real. We're seeing it. Who are the folks our people are being impacted the most? What states are you looking at where this is being a problem?
Well, I think we've all seen right now, Texas is definitely a problem. We've seen spikes go up in Texas, but it's not just Texas. Texas, Florida, South Carolina, Alabama, several other states in the South, even Oklahoma, have now displayed the highest cases in a single day has occurred either yesterday or today. So really, we're seeing cases go up, number of positive cases go up all over the country. And the big challenge that I see with this is that the federal government just yesterday announced that they were halting the testing component of the CARES Act, which was supporting testing, federally funded testing in multiple states, one of which was Texas. And so now that means that states and hospitals will no longer receive that federal funding to support testing, and they will have to find testing resources, which has been a challenge since the beginning of this crisis. But at least some places had some federal support. That funding is ending, and they'll be on their own to find the testing supplies and resources.
I got to ask you this here. What do you make of this story? An Oregon County has decided to make people of color exempt from its mandatory mask policies, citing the potential for racial profiling. Okay, I'm trying to understand that now. Lincoln County's general director requires everyone to wear a face covering in any indoor public setting or any outdoor setting where 6 feet of social distancing can't be maintained. But the county wrote on its website, quote, people of color who have heightened concerns about racial profiling and harassment due to wearing face coverings in public are exempt from the rules. Okay, I'm sorry, go right ahead.
The problem, this is a symptom. Right? So we're saying because systematic racism exists, and implicit bias has not been dealt with, that instead of dealing with people's own implicit biases, instead of dealing with systematic racism, we say, let's put the Black people and people of color at risk because we can't check ourselves and not racially profile you. That's basically what it sounds like people are saying. And that's a problem. It has to be a problem. We have to protect ourselves. I think every individual, it's your right to protect yourself. And remember, your mask, so my mask protects you from me. And so I tell my 8-year-old daughter and my 6-year-old son that wearing a mask is how we tell our friends that we care about them. So me not wearing a mask, really, it's not that I'm not protected. I'm not protecting you from me. We've got to get this in our heads that, one, we have to deal with implicit bias, and we have to deal with systemic racism, and that's been plaguing our country for 400 years, and it's showing up even more with the disproportional effect of this virus in minority communities, not just Black communities, Hispanic and Latinx communities, Native American communities, but for us all to get through this, we've got to put on masks, and we have to be able to get tested.
All right, then. Well, I wish these political people, who are so focused on, look, they're focused on trying to please Donald Trump, who desperately wants to get reelected. And you know what's so crazy? If he actually showed leadership and we actually went to massive testing,
right,
it probably, that would actually be seen as a good thing. But you know what? Okay, he won't be stuck on stupid. Go right ahead. I just keep telling Black people, don't listen to them. Keep your behind at home, wash your hands, put your mask on, stop having these damn group gatherings. All y'all Black people in Atlanta, take your asses home. All standing in line for Nikes, been at the mall. The nonsense that we're seeing across the country is crazy. I'm sorry, your life ain't worth a pair of Air Jordans. I'm just saying.
Exactly.
Dr. Culbreath, we appreciate it. Thanks a lot.
Thank you.
All right, folks, back to our Roland Martin Unfiltered video in just one moment.
All right, fam, the folks at Ceek.com, founded by Mary Spio, a sister, of course. She is the inventor, the creator of these devices, this virtual reality headset right here. You saw it in the video there. And also the 360-degree 4D headphones. You can actually get these with a discount because they partner with us at Roland Martin Unfiltered. Right here, here's the code, RMVIP2020, RMVIP2020. First of all, folks, the headsets are phenomenal. The headphones are absolutely phenomenal. And of course, the VR headset is great because you just pop your phone, put it into the device, and then you can actually see video in virtual reality. So it's real cool. Go to Ceek.com, 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 and use the promo code RMVIP2020.